still on your policy has had a pre-existing condition, they won't cover you. They won't cover you. But Mr. Romney didn't say that. He didn't say that on Meet the Press.
I asked the senator from Iowa, have you met people in your state? I've met some in Illinois who said to me, I cannot leave my job. Sure. Cannot leave my job.
Right.
Because I don't know that I can ever find health insurance again. I'm stuck. Because I have a child with a problem, a spouse with a problem. I mean, the real world of human experience tells us this happens all the time. And you wonder sometimes, 89 million Americans, almost 1 out of 3 Americans, are not covered by this Romney plan. How does this solve any problems? If we are not going to have health insurance that we can count on when we need it, it's worthless. It is a subsidy to the insurance companies. It doesn't pay off when the family needs it. I didn't mean to interrupt the senator from Iowa, but I wanted to make that point very, very strongly.
Well, I appreciate Senator Miller. I just would say one other thing to my friend that brought it up, and that is this idea of this individual mandate that then Governor Romney supported in Massachusetts. You know, we all have it within us, I think, especially as Americans. We don't like to be told anything. We don't like to have a mandate put on us. Well, as the chair of the Health Committee and someone who is very much involved in this process of getting the Affordable Care Act through, I just want to make it very clear. You don't have to buy insurance. There is no individual mandate that you have to buy insurance. I want to make that clear, and I'm going to keep making that point. I've been making it for months now. You don't have to buy it. It just says if you don't buy it and you get real sick and you want to get in line to get health insurance, you pay a penalty. You call it a free rider penalty. That's what it is, a free rider penalty. Have we ever seen that before? Yeah. How about Medicare? We have it in Medicare. When you turn 65, you don't have to get Part B. No one tells you you have to do that. But if you wait until you're 67 or 68 or 69 or 70, you pay more. You will pay a lot more because it's a free rider penalty than if you picked it up when you were 65 or 62 when you retired. So we've got to get this idea that this is some kind of individual mandate, that you're forced to do something. No, you're not forced to do it. But if you're a free rider and you say, well, but I'll only go when I get sick, like the car accident that the senator pointed out, yeah, you pay a penalty. That's all. But you don't have a mandate. You just have to pay a penalty. I think when you describe that, as I tell Iowans that, they say, yeah, that sounds fair. That if you're not going to be in the insurance pool, it's like, you know, I'm not going to have car insurance. But if I have a wreck, you know, I want to call insurance company, and they will insure me to the moment right before the wreck. It's nonsense. Of course we don't do that. Of course we don't do that. Well, again, as I said, Mr. President, I intend to take the floor today, tomorrow, and for the next several days to point out what the Ryan plan does, both in an overall but basically in health care. Basically in health care. We mentioned Medicare. Let's talk about Medicaid. How about Medicaid? Medicaid. Let's see. What does Medicaid do? Medicaid basically, as I've said many times, is there to give a decent quality of health care and a quality of life to the hopeless, the helpless, and the hapless. People who otherwise just sort of fall through the cracks. People who need health care who can't afford it, or who, because of their life situation, have never been able to get any kind of health care coverage. Well, here's what he does. I'll get into this more. Medicaid funding, the senator from California mentioned that. Over 10 years, takes $810 billion with a B, not million, $810 billion out of Medicaid. So, what does that mean? Who does that hurt? Who does that hurt? Well, 1 out of every 2 Americans with a disability. 1 out of every 2 Americans with a disability uses Medicaid. That's who's hurt. That's who's hurt. Services from the Medicaid program allow our citizens with disabilities to live with dignity and purpose in their homes in their communities. 3 million seniors and people with disabilities use the program to avoid having to go into a nursing home. How about Medicaid for middle-class families? We always think that Medicaid is just for, okay, people with disabilities. I got that one, Harkin. Or it is poor people. How about Americans in the middle class? How about an American family, middle-class family, hundreds of thousands of American families who have children with lifelong disabilities like Down syndrome or autism? Medicaid gives them a lifeline. Or they would be paying out of their pockets from middle-class families for the care and the health care costs of their children for their entire lifetimes. Yes, this is one of the entitlements they want to cut. Medicaid's entitlement. Well, how about that tax plan? If you're a millionaire, that's all you have to be. All you have to do is have an income over $1 million a year, and you get huge tax benefits. How about that entitlement? Well, they don't touch that one. So the Ryan budget, at the center is his promise to repeal the Affordable Care Act, Obamacare. 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 A common-sense health reform that led the Commonwealth of Massachusetts to have one of the lowest uninsurance rates in the country. Obamacare. I know the Republicans have been using that as a pejorative. I say it proudly. I was with President Obama in Iowa a couple of weeks ago when he spoke to a huge group of students at my alma mater, Iowa State University. And there was a big sign in the back that said Obamacare. And President Obama looked at it and he said, yes, Obamacare. He said, speaking of himself in the third person, he said, yes, Obama does care. He says, I care about making sure you're covered with pre-existing conditions. I want to make sure that kids can stay on their parents' policy while they're in college. Yes, I want to make sure that the elderly have a good, affordable Medicare program. Yes, I want to make sure that people have good preventative health care systems in America. Obama cares. That's what Obamacare is. Obama cares. And he cares very deeply that we have a health care system for all and not just for a few. As was said by President Clinton in his speech, he said, an American policy based upon we're all in this together is much better than the policy of tough luck, you're on your own, which is the Ryan budget philosophy. Well, when you get past the political theater and look at what the Ryan budget actually means, it's not a very pretty picture. Ryan budget would repeal the prescription drug donut hole closure that we're doing. It would allow insurance companies to charge as much as $300 for preventative services, one of the key elements we put in Obamacare. 86 million Americans now receive at least one free preventative service last year, more this year. Almost 1 million Iowans in my state received one free preventative service in 2011, meaning they got preventative care so they don't get sicker and cost us more money. The Ryan budget, again, would allow people to deny you coverage or increase your premiums if you have a pre-existing condition. This protection means a lot to this person right here. This is Eleanor Pierce, Cedar Falls, Iowa. I spoke about her before. Who was denied health insurance when she lost her job because of her pre-existing condition of high blood pressure. Without coverage, she racked up $60,000 in medical debt. Ryan budget. They would repeal Obamacare. They would tell people like Eleanor Pierce, tough luck, you're on your own. We're not all in this together, you see. Tough luck, you're on your own. You mean you're not worth $1 million? Tough luck. You're on your own. Repeal would allow insurance companies to put limits on the coverage of more than 100 million Americans, stopping benefits right when they get sick. Repeal would kick more than 3 million young people off their parents' policies. This was Emily Schlichting, who testified before our committee, eloquent young woman going to college in Omaha. She said, young people are the future of this country, and we are the most affected by reform. We're the generation that is most uninsured. We need the Affordable Care Act because it is literally an investment in the future of this country. She suffers from a rare autoimmune disorder that would totally make her uninsurable in the old days and under the Ryan budget, which is and which brings back those old days. Thanks to the Affordable Care Act, she can stay on her parents' policies till she's 26, and by 2014, regardless of her pre-existing condition, she'll get affordable health insurance coverage. Repeal under the Ryan budget would allow insurance companies to spend Americans' premium dollars on CEO bonuses, marketing, fancy buildings, rather than actual health care. Under the health reform medical loss ratio requirement, policyholders nationwide will receive more than $1 billion in rebates from insurers this year. $1 billion in rebates this year. Back to policyholders, back to families. Otherwise, that $1 billion would be going into, yes, CEO bonuses, marketing, private jets, company planes, things like that, fancy buildings. Well, these are just a few of the ways that the Romney-Ryan budget would repeal Obamacare and drag America backwards, back to the bad old days. Now, over the last few weeks, again, I will just repeat, Representative Ryan's been telling anyone how the President's health reform plan robs Medicare. Totally fallacious. First, the nonpartisan economists have certified that Obamacare strengthens the Medicare program, extends its solvency by 8 years. What President Obama did, as the senator from California previously pointed out, it makes the program more efficient, saving money on wasteful overpayments to private insurance companies, cracking down on fraud. Now, what Mr. Ryan won't tell you is that the very reforms that President Obama has in our Affordable Care Act is the same that he has in his Ryan budget. What he doesn't tell you is that while President Obama takes those savings and puts it back into Medicare, Mr. Ryan takes those savings and, yes, you guessed it, puts it into more tax breaks for the wealthy. By repealing the Affordable Care Act, the Ryan plan would again put Americans at the mercy of insurance companies and deprive more than 30 million people of affordable coverage. I was just looking at my own state of Iowa here. I have one here on Iowa that I wanted to point out because I'm obviously very interested in what happens to my seniors in Iowa. The Ryan plan means that almost 440,000 Iowa seniors would be forced to vouchers when they retire. You know, you get those vouchers, right? 60,000 Iowa seniors would be forced back into the prescription drug donut hole. The donut hole would open up again. 400,000 Iowa seniors would pay more for preventative services this year. And I can tell you, our seniors in Iowa are flocking to get their preventative health care services. They know. They know. An ounce of prevention is worth a pound of cure. But before, those preventative services cost money. Now they get them free. And it's going to save and make their lives better and save us a lot of money. So Obamacare decreases the deficit by almost $110 billion over the first 10 years, more than $1 trillion in the next decade. Mr. Ryan and Mr. Romney won't tell you that. But it's true. Reduces the deficit. Reduces. the deficit. And it ensures more than 94% of all Americans, over 94% of all Americans, will have that coverage. Mr. President, the bottom line is very simple, and I'll be talking about this in the days ahead. President Obama will protect Medicare, will protect health care not only for our seniors, but for young people, for middle-class Americans, and yes, for those on the bottom rung of the ladder who need Medicaid to sustain them and to give them quality health care. The Ryan budget rolls back all of this, rolls it all back. And so again, we are faced with this choice, The Ryan budget or what President Obama has come forward in his budget and with his Obamacare to make sure that America remains a good middle-class country where people on the bottom have the rungs in the ladder to get into that middle class, where the middle class knows that they can leave a job and go to another job and not lose their health care plan, where someone can start a small business and know that they will have health insurance coverage for themselves and the 1 or 2 or 3 or 4 or 5 workers who work for them. Our small businesses now will become more competitive with the big businesses in America. Mr. President, I think it's safe to say that if only the American people will just study the Ryan budget, the blueprint, this is where they want to take you. This is where they want to take me. This is where they want to take all of America. Back to an America that our parents moved beyond. That our parents said, no, we're going to move forward, which we have buttressed ourselves in our own lifetimes, in moving America forward to a country where we truly are all in this together, where we are not just a lottery country, where if you win the lottery, you're okay. You got it made. If you don't, tough luck, sucker, you're on your own. That's not the America that our parents fought for in World War II or in Korea or Vietnam. It's not the kind of America that Martin Luther King Jr. marched for and died for. It's not the kind of America, that we want to see for our kids and our grandkids. So, Mr. President, we have a choice. The choice is clear. Let's move forward. I yield the floor.
Clerk will call the roll.
Mr. Akaka.
Senator from Illinois.
I ask consent the quorum call be vitiated.
Without objection.
Mr. President, most commissions that are appointed in Washington, at least my experience suggests, hardly make a ripple. People hardly notice them. After a lot of hard work, a report is published, and that's about it. Some historian at a later date may look at the work they've done and the research they've done, and that's about it, the extent of it. There are a few exceptions. And I was fortunate enough almost 2 years ago to be appointed to one of those exceptions, and that was President Obama's Deficit Reduction Commission, the Simpson-Bowles Commission. And I was appointed because I'm a member of the Appropriations Committee, and Senator Reid said we should have someone on there from Finance, Appropriations, and Budget. I took the assignment, one of the 3 Democratic senators. There were 3 Republican senators, 3 Republican House members, 3 Democratic House members, and an additional 12 members. Well, that would be additional 6 members, I should say, appointed by the President, public members. The public members consisted of a number of people, Ellis Rivlin, who's well respected in Washington, as well as business leaders and community leaders. We met for about a year and considered the budget deficit and all of the federal spending and came to know one another a little bit during that period of time. One of the members of that commission was Paul Ryan, congressman from Janesville, Wisconsin, just over the border from my state of Illinois. I knew Paul before, got to know him a little better during the course of that commission. He's a very bright person. We have some common friends in the Janesville area, and I know that he had worked with Senator Feingold, Democrat of Wisconsin, on some issues before. What surprised me at the end of the day was, despite his obvious training and knowledge in the budget deficit, when it came time for a vote on this bipartisan deficit commission report, all 3 House Republican members, including Congressman Paul Ryan, voted no. I voted yes. 2 out of the 3 Democratic senators voted yes. And I was surprised in a way because I thought that although the Simpson-Bowles plan had its shortcomings, things I disagreed with and said so, it really was a dramatic step forward to try to deal with our deficit in a fair fashion. Jeb Hensarling of Texas was another Republican congressman, and Dave Camp of Michigan, chairing the Senate Finance Committee, with Congressman Paul Ryan, they all voted no. I was surprised at the Republican convention in Tampa, Florida, when Congressman Ryan, the Republican vice presidential nominee, criticized President Obama over this commission, the Simpson-Bowles Commission report, saying he hadn't worked hard to implement it. I thought that was a curious position for Congressman Ryan to take because he had voted against it. Now he was criticizing President Obama for not working hard enough on the commission report. But I came to understand that a little more when I took a closer look at Congressman Paul Ryan's budget plan for America. Before he was chosen to run as Governor Romney's running mate, Paul Ryan, the congressman and chairman of the House Budget Committee, issued his vision of what America should be doing over the next several years. One of the most controversial sections relates to Medicare. Medicare, of course, is the insurance policy for the elderly and many disabled in our country. It is, for 40 million plus Americans, a lifeline. It means even in their old age, they will have good protection from health insurance because they've paid into it during all of their working years. Paul Ryan observed that the Medicare program would come to an end if it weren't changed. We know that it has about 12 years left of solvency and change will be needed. His proposal, though, would do more than change Medicare. It would end it as we know it. The Ryan approach would create vouchers, coupons for senior citizens to buy health insurance. It would force them to pay more out-of-pocket for Medicare. According to CBO, Congressional Budget Office, the Romney-Ryan plan would force Medicare beneficiaries to pay up to $1,200 more by 2030 and almost $6,000 by 2050. That's about $500 a month, ultimately. Congressman Ryan said seniors could choose to stay in traditional Medicare or he could basically go into a private health insurance market. Now, a senior who is both healthy and wealthy would have an option. Those not so healthy or wealthy would find the only option, traditional Medicare, and more people with a history of illness would be forced into traditional Medicare, making it a very expensive insurance program and difficult to maintain. The Paul Ryan voucher plan puts Medicare in competition with private insurance companies, and as I said, many seniors would find that the competition wouldn't want them, and they'd be stuck with traditional Medicare, much different than it is today. Medicare would be taking care of the seniors whose care costs more, so Medicare premiums would increase. And as they go up and seniors begin to leave Medicare, it causes premiums to rise further, which would cripple the program. The Paul Ryan plan eliminates all the consumer protections in the Affordable Care Act, putting insurance companies back in the driver's seat. I don't think most Americans believe that's a good place to be, at the mercy of an insurance company, an adjuster who would decide whether you're covered and how much they'll pay. Young adults would no longer stay on their parents' insurance plan under the Romney-Ryan proposal to eliminate Obamacare. People with pre-existing conditions would be denied coverage, subject to the conversation I had earlier, dialogue with Senator Harkin on the floor. Families would once again face lifetime limits on coverage, and seniors would be forced back into the donut hole, meaning paying more out-of-pocket expenses for their Medicare prescription drugs. I don't think this is a good plan for America, and I don't think Americans, once they hear the details, are going to like it. The Obamacare program has already helped a lot of people. The report today said that there was a 16% increase in coverage of younger Americans because of Obamacare. These are younger Americans up to the age of 26 who now can stay on their family plans. 1.6 million Americans have been added into coverage under their parents' plan because of this change in the law. Now, those who say, I'll repeal Obamacare, would repeal that protection, forcing 1.6 million young people without jobs or coverage out of the protection they have today. I can't imagine 125,000 young adults in Illinois who benefited from Obamacare would believe that's a good idea, nor would their families. Since the Affordable Care Act, incidentally, was signed into law, Medicare beneficiaries in Illinois have saved over $171 million on their prescription drugs. There was a discussion earlier about Medicaid program. Medicaid is an important program in Illinois and most states. I asked Julie Hamos, who administers our program in Illinois, to explain it in a few words, and here's what she said. 1 out of 3 children in Illinois are covered by Medicaid. That is their health insurance, 1 out of 3. Medicaid pays in Illinois for 52% of the births. That's prenatal care and delivery of the child. 52% paid for by Medicaid. But those two things, child coverage and coverage for new moms and their babies, doesn't even represent half the cost of Medicaid in Illinois. 60% of the cost of Medicaid in Illinois is for the elderly and disabled, many of whom are just completely out of luck and out of money. They live on Social Security, Medicare, and Medicaid. They're in nursing home and convalescent centers. They don't have any place to turn. So Medicaid is a critical insurance program for some of the most vulnerable people in America. Most seniors and disabled people on Medicare also receive state Medicaid. The dual eligibles are called. That's 15% of Medicaid enrollees, but 39% of Medicaid spending. Low-income elderly people who have no place else to turn. So when Paul Ryan in his budget suggests he's going to cut back on Medicaid payments each year, giving a smaller amount of money to states saying make do, who is at risk? Children, 1 out of 3 in Illinois on Medicaid. Moms having babies, over half of the moms having babies in our state, and the elderly folks who have no place to turn. Think about what that means. A child without basic health insurance, Medicaid, in my state or anywhere, is less likely to have a doctor, immunizations when needed, and an office visit to avoid a trip to an emergency room. A mother without prenatal care is unfortunately more likely to give birth to a child with a problem. And we don't want to see that for the sake of the child first, certainly for the mom, for the family, or for taxpayers, for goodness sake. There's no money saved by scrimping on medical care for new moms. The Ryan plan would force that kind of scrimping. The Ryan plan converts Medicaid into a block grant and cuts federal funding for the program by 34% over the next 10 years. 34%. So I'd ask Congressman Ryan, which of those groups do you want to cut back on in terms of coverage? According to CBO, cuts at the level the Ryan plan calls for would mean states would have to reduce eligibility for Medicaid and children's health insurance, or cover fewer services. And I might add, Mr. President, I'm sure it's true in the state of Oregon. It's certainly true in Illinois. One of the most critical areas of medical need is dental care. I talk to doctors every time I go back home in emergency rooms at hospitals who have people coming in to see them in pain because of problems with their teeth. And they end up getting pain medication, but nothing's taken care of. So when we talk about restricting care, as Paul Ryan has suggested in his budget, I have to tell you, I think it's extremely short-sighted. A toothache can turn into a life-threatening situation for some people, not to mention the pain and discomfort they're going through. So if anything, we ought to be reviewing basic Medicaid services to expand at least into dental care. I would support that. I think it is extremely short-sighted for us not to include it. This Paul Ryan budget wouldn't expand Medicaid. It would cut it back dramatically. States would lower payments to doctors and nurses by a third. Can you imagine what that would do? It would reduce the number of providers, which makes it more difficult. Just to give you an example, in the Quad Cities in Illinois, there's a great clinic put together by a friend of mine in the Hispanic section of Moline, and they provide basic primary health care. If you need a specialist, you're referred at least an hour-and-a-half drive to Peoria or almost 3 hours drive to Chicago. Remember, these are the poorest people living in our towns. Do they make it to the specialist? Usually not. The Paul Ryan approach, reducing the amount of money that's paid to providers, would mean even fewer specialists would be willing to help those who are poor. But the thing that troubles me the most about Congressman Ryan is, at least in his budget views and his deficit views, as he talks a good game about reducing the deficit and voted against the Simpson-Bowles Commission report, he comes up with a budget that he produces in the House and says he and Governor Romney are going to protect the Bush tax cuts for the wealthiest people in America and increase defense spending. This does not work. It doesn't add up. It doesn't pass what President Clinton called the arithmetic test. You can't increase tax cuts and increase spending on defense without, as President Clinton said, digging the hole deeper and deeper. So they sound pretty good when they give the speeches about fiscal conservatism. We've got to be serious about the deficit, but their proposals just don't match. The idea of lowering tax rates, as they proposed, even below the Bush tax cuts, they said, well, we'll use tax reform to get to it. The estimates suggest that the middle-income families will end up losing in that. As a result of tax reform as proposed by Romney Ryan, they think middle-income families face a higher tax of $2,000 a year to protect tax cuts for the wealthiest people. That certainly is not a positive thing in terms of deficit reduction or helping a lot of working families living paycheck to paycheck. We've debated Congressman Ryan's plan for 2 years now. The only people who seem to like it are some Republicans serving in Congress. The majority of Americans would oppose the Paul Ryan budget plan to end Medicare as we know it. The majority of Americans certainly oppose his idea of raising taxes on middle-income families to pay for tax breaks for the wealthiest. Congressman Ryan has had his chance to make his case to the American people for his view of where we're going, and it won't work. I wish he had joined us in the bipartisan effort of Simpson-Bowles. His vote in favor of that would have given him more credibility and maybe a better understanding of the reality of budget deficit reduction. Mr. President, I ask unanimous consent the Senate proceed to a period of morning business with senators permitted to speak therein for up to 10 minutes each.
Without objection.
I ask unanimous consent the Senate report number 208 be star printed with the changes at the desk.
Without objection.
I understand that S-3519 is at the desk and due for a second reading.
The clerk will read the title of the bill for the second time.
S3519, a bill to require sponsoring senators to pay the printing cost of ceremonial and commemorative Senate resolutions.
I would object to any further proceedings with respect to the bill.
Objection is heard. The bill will be placed on the calendar.
I understand there are 3 bills at the desk. I ask for their first reading in block.
Clerk will read the titles of the bills for the first time.
H.R. 8, an act to extend certain tax relief provisions enacted in 2001 and 2003 and for other purposes. S3522, a bill to provide for the expansion of affordable refinancing of mortgages and so forth. S3525, a bill to protect and enhance opportunities for recreational hunting, fishing, and shooting and for other purposes.
I now ask for the second reading on block. I object to my own request on block.
Objection is heard.
I ask unanimous consent that when the Senate complete...
Just a moment. The bills will be read for the second time on the next legislative day.
Thank you, Mr. President. I ask unanimous consent when the Senate completes its business today to adjourn until 10 a.m. on Tuesday, September the 11th, 2012. Following the prayer and pledge, the journal of proceedings be approved to date. The morning hour be deemed expired. The time for the 2 leaders be reserved for their use later in the day. That the majority leader be recognized and that the first hour be equally divided and controlled between the 2 leaders or their designees, with the majority controlling the first half, the Republicans controlling the final half, and that at 11 a.m. there be a moment of silence in observance of the 11th anniversary of the attacks on September 11th, 2011. Further, that the Senate recess from 12:30 p.m. until 2:15 p.m. to allow for the weekly caucus meetings.
Without objection.
The first roll call vote tomorrow will be at 2:15 p.m. on the motion to invoke cloture on the motion to proceed to S3457, the Vet Jobs CORA Act. And if there's no further business to come before the Senate, I ask that it adjourn under the previous order.
The Senate stands adjourned until 10 a.m. tomorrow.
Earlier today in the Senate, members confirmed the judicial nomination of Stephanie Marie Rose to be a U.S. District Judge for the Southern District of Iowa. Tomorrow, legislation relating to veterans and jobs. The measure aims to provide veterans looking for job training while giving them priority for federal jobs in forest management and public safety. A procedural vote on the motion to proceed is expected. Live Senate coverage returns here on C-SPAN 2 when members gavel back in on Tuesday.